Novant Health Forsyth Medical Center is celebrating the 30th anniversary of its Heart and Vascular Institute this month. And we have with us today Dr. David Duncan, cardiothoracic surgeon at Novant Health. And thank you so much for joining us. We do appreciate it.
Thank you for having me, Margaret.
All right, so tell us, what are some of the new services that have recently been added to the hospital?
Since 1987, when we did our first open heart, we've done 20,000 patients open heart surgery at Forsyth Hospital. And roughly about 700 hearts a year are being done now, making us about the fifth busiest hospital in the state in terms of heart volume. More importantly, during that period of time, if you look at some of the national metrics, such as the outcomes and patient satisfaction and those sorts of things, we've been consistently ranked in the top 10% throughout the country. So we're very proud of that. We've been very happy with that.
That's some amazing stuff. So can you talk a little bit about some of the kinds of changes that you have seen that have occurred over the last 30 years?
The first thing really starts with Novant Health itself. When I first arrived here 25 years ago, we were all part of private practice, and now we're part of the Heart and Vascular Center at Forsyth Hospital. So we are now part of a fully integrated, multidisciplinary team approach for providing state-of-the-art health care to the patients here. And by using metrics to look at the focus on how to improve care, we're able to make sure that we meet the needs of the community as well as provide the best service that we possibly can.
And what about technology? How has that changed?
So some of the cool technology that we've seen that's really come across my favorite is TAVR, or transcatheter aortic valve replacement. And that's a procedure where I can go in now and replace aortic valve in the heart without cutting somebody's chest, without stopping their heart, without putting them on the heart-lung machine, thereby making the procedure available to patients who might have been very elderly or not operative candidates before or had associated medical conditions that wouldn't have allowed them to have surgery. And those technologies are being extended to other valves in the heart as well.
Any other kind of cool technologies?
Absolutely. So some of the mechanical heart support stuff is really neat, where they're much more available, user-friendly, that we can use to get patients through heart surgery who previously would have had heart conditions where their heart was so weak we wouldn't be able to do their surgery, and now we can get them through that surgery. In the field of lung cancer, we're doing smaller and smaller incisions, doing minimally invasive surgery, taking advantage of video cameras and robotics so that the patients have less post-operative pain from their incisions and recover more quickly.
All right, you guys rock. High five on all of this.
Thank you.
Thank you so much for joining us today. We do appreciate it.
Thank you for having us.